Dentigerous cyst. This common cyst surrounds the crown of the tooth and is an expansion of the follicle caused by separation of the reduced enamel epithelium from the enamel. The cyst is therefore odontogenic. The cyst wall is attached to the neck of the tooth, prevents its eruption, and may displace it for a considerable distance. Definition: the dentigerous cyst is the cyst around the crown of the unerupted tooth with the epithelium lining attached around the cement-enamel junction. Clinical feature: dentigerous cysts are more than twice as common in males as females, and two-thirds develop in lower third molars. Upper canines and lower premolars are also affected, reflecting the most frequently impacted teeth. These cysts present between the ages of 10 to 30 years. They grow by internal pressure and cause the same clinical features as other cysts that expand the jaw. Expansion with displacement of the adjacent structures. They are often a chance of radiographic finding when the cause is sought for an unerupted tooth. Radiography. The cavity is circumscribed, round, and always unilocular and contains the crown of tooth. Dentigerous cysts grow slowly and have corticated outline. Cysts may attain a very large size, larger than 10 centimeter, and large cysts may appear to be multilocular on the radiographs because bony ridges on the inside of the bony cavity are superimposed on the image. The affected tooth is often displaced a considerable distance, lower third molars to the lower border of mandible or high in the ramus. In long-standing cysts, the enclosed tooth may become resolved. Pathogenesis. Dentigerous cysts are considered to be developmental, but inflammation from the pericornitis or the adjacent non-vital tooth may initiate some. Multiple dentigerous cysts are seen in those with cleidocranial dysplasia who have many unerupted teeth. The earliest event is separation of the reduced enamel epithelium from the crown to form a cyst space. The epithelium is tightly bound to the enamel during formation, but more loosely attached after a normal time of eruption. But the reason for separation is unclear. As the reduced enamel epithelium stops at the cementoenamel junction, the lining epithelium is attached there, and the fibrous wall is continuous with the periodontal ligament. The cyst enlarges by internal pressure, expanding the dental follicle, displacing adjacent structures, and eventually expanding the jaw. The histology. The wall of the dentigerous cyst in their early stage comprises an uninflamed fibrous wall lined by a thin, sometimes bilamellar epithelium that resembles reduced enamel epithelium. While the cyst enlarges, a degree of inflammation usually develops, and the inflammatory or metastatic changes can develop to differing degrees in different cysts. There may be frequent mucus cells or focal keratinization. Once significant inflammation supervenes, the appearance come to resemble the radicular cyst, and the diagnosis can no longer be made on biopsy alone. Differential diagnosis. The key diagnostic feature is the dentigerous relationship to the tooth. It is normally possible to make confident diagnosis radiographically processed to treatment without biopsy, confirming the diagnosis after enucleation. However, care must be taken not to be caught out by other lesions. Simulating, simulating a dentigerous relationship. An odontogenic keratocyst, ameloblastoma, or other radiolucent lesion may occasionally grow around the crown of unerupted tooth to create a similar radiographic appearance, identifying a clear attachment at the cement-enamel junction. will reduce the likelihood of this error. Because of this risk, the diagnosis should always be confirmed by histological examination, primarily to exclude other unexpected lesions. It is also sometimes necessary to differentiate an enlarged follicle from a dentigerous cyst. The width of the normal follicle radiographically can be 2 to 3 millimeter. If there is uncertainly, however, a cyst space has developed, radiographic radiographic follow-up rather than innervation is appropriate. Treatment: